Hey everyone, welcome back to the Graduate Guide. Today I'm joined by Raghib. Raghib is the CEO of Our Future Health UK. Welcome to the show, Raghib.
Good morning.
Thanks so much for coming on. I guess the perfect place to start would be to tell the listeners a bit more about the work you're doing at Our Future Health.
Sure. Thanks for inviting me on firstly. So Our Future Health is a new research program, but it's going to be the world's largest research program quite soon. And what we're really focused on is how to better prevent common chronic diseases like diabetes, heart disease, cancer, dementia, mental health disorders, obesity, etc. So the way we've really developed medicine, delivered medicine for most of the history of the NHS is to treat people when they've already developed disease, when they've already got symptoms and signs. What we're trying to do through Our Future Health is really to see how we can identify people at higher risk earlier, intervene earlier, and thereby prevent those diseases.
Amazing. That's a great cause. I can't say anything more than that. How did you come to join the organisation?
So do you want the long version?
Whichever's best for the listeners.
Or the short version. I mean, the scenario I've been working in, by background, I'm a medical doctor.
Yeah.
And so I'm a consultant in acute medicine. That means I work mainly in A&E, seeing patients with things like heart attacks, strokes, infections, kidney failure. So that's really seeing people at the end stage of a disease, when they've already had this disease probably for decades, and then they end up with a heart attack or a stroke, something like that, or a cancer that's already spread. But in parallel, I've been interested in what causes disease. So I'm also an epidemiologist, which means that we're focused on disease in the population, not just in the individual. So I've spent much of my career in research, trying to understand what causes disease, and particularly in trying to understand cause in populations that haven't been studied before. So in the UK, that's mainly ethnic minorities and more deprived populations, and then globally, lots of populations haven't been studied. So I've worked in India, I've worked in the Middle East. In terms of Our Future Health, so the project was launched or announced in 2019. Professor Sir John Bell, who was the Research Professor of Medicine at Oxford, was the Life Sciences Champion, or is the Life Sciences Champion. He launched it back in 2019. It started around 2020. He asked me to join the program early on, but the reason I couldn't join actually is because of COVID. So I think my first meeting was December 2019, and then obviously the pandemic struck.
Yeah.
So I spent 2 years, kind of 2020, 2021, mainly working on COVID. So partly on the front line, working in A&E, seeing patients with COVID. Also as an epidemiologist, trying to understand why COVID is affecting some groups, particularly some ethnic minorities, more than others. And thirdly, on the vaccine program, trying to ensure that we had good uptake across the whole population. So it was finally in January 2022 that I joined Our Future Health as Chief Medical Officer. So that's based on my background, both as a researcher, but also clinically. And I'd run similar studies before on a smaller scale. I mean, this is on a scale that we've never seen before. We're trying to recruit 5 million people.
Wow. Wow.
The previous studies I'd worked on for the last 8 years, we were trying to recruit 20,000 people. Well, I did work on UK Biobank briefly, which is 500,000 people, and that was the previous largest study.
Yeah.
So I started as Chief Medical Officer in January 2022, and then in September 2023 is when I was appointed CEO.
Amazing. And what was that like, transitioning from Chief Medical Officer to CEO? The reason I ask is that prior to that, right, you've never been a CEO anywhere else. I assume you'd managed teams and managed people, but how was that transition going into being the CEO of, like you said, a massively fast-growing organization?
So it was a big change, and in some ways a big challenge, but also a big opportunity. And generally in my life, I've always seen challenges as opportunities, and I've had a slightly unconventional kind of career path, which maybe we'll come back to. But I had run a university department before, so I had some experience of running, a department, not on the same scale. That was about 40 people, with a relatively small budget, so a few £1 million a year. Our Future Health, you're right, is on a different scale. Although when I joined, we were 40 people. It's now 250 people. Our annual budget is in, three-figure million, over £100 million a year. And it's a big project, as I said. It's the biggest health research project in the world. But so far so good. I'm enjoying it. The main change, I guess, is there's no one really above you that you can ask for, or to delegate things upwards. You can delegate things outwards, but the buck kind of does, to use the expression, the buck does stop with you. So that puts some pressure on. But I think partly because of my background, I don't feel that pressure that much, because it's not as much pressure as, for example, dealing with patients in A&E or even during COVID. That was probably the highest pressure situation I've been in the first wave, particularly.
I was actually going to come back to that, because I think for students especially, or young people listening, there will be a lot of times throughout their journey so far where they've experienced high pressure situations. Nothing to that extent, but for them, I'm sure exams, assessments feel like they are as high pressure as it could get at those points in their career. Do you have any tips for how students can, and people in general, can actually deal with that pressure, how they can still kind of, I guess, execute effectively under that pressure?
So I've got a lot of experience in exams.
I can
I
imagine.
think I've got 8 degrees now. So I've done a lot of exams over the years. So I very much can identify with what you say. I was a student for a long time as well. Maybe
Yeah.
a student from 1994 full time until 2000 as an undergraduate, studying medicine at Cambridge, and then postgraduate degrees carried on until 2020 actually. So my final, or 2019, my final Viva I think
So
was
you
in
can
2019.
can definitely relate to the students out there.
So I've been a lifelong student, and I think in some ways we're always, of course, learning.
Yeah.
But in terms of pressure situations, even at school, university, I think what was always helpful for me was, I guess, partly by nature. I don't panic particularly. I've always been fairly calm, and it's always putting things in context. What's the worst that kind of happen if things go wrong. I mean, certainly over the course of my career, that's become an even bigger thing. When I'm in the hospital, the worst that can happen is someone can die. That's and everything else in the context, putting in that context is less pressurized.
Yeah.
I mean, you're right. For the average student, your exams, assignments, getting a job, etc., are high pressure. Now, it's not that I didn't feel that, particularly when I was doing my finals for medicine. Actually, one of the reasons I felt more pressure at that time was because I hadn't got a job. So normally you have a job before you graduate as a medical student, because that's the way the system works.
Yeah.
But for various reasons, maybe slight overconfidence, I didn't apply for enough jobs. And so the job that I'd applied for in Cambridge, I didn't get. And but that, in fact, turned out to be a great blessing in disguise, because the job I did get was at Oxford. And moving to Oxford in many ways led to the rest of my research and the career that I pursued, because Oxford was much stronger in epidemiology than Cambridge, which tended to be stronger in kind of basic science. So yes, I think overall my advice, and in fact my 2 sons at the moment doing exams, my son's doing A-levels, the advice I always give in terms of exams is not to panic. If you have a bad first part of the paper, if you panic, that makes the second part of the paper worse. If you have a bad day, that makes the next day worse. So it's always thinking positively as much as possible. And if you found the paper hard, then almost certainly everyone else has found it hard as well. And that's something you don't realize at the time. And you can't always take what other people say about how they found a paper. And I certainly found that particularly when I moved to Cambridge, which was a very different experience for me, having come from a very different background to most of the other students. And I always felt I'd be towards the bottom of the class.
Yeah.
And I probably was until we actually got our first year exam results in our college. And then I thought, okay, maybe I'm not at the bottom of the class. And that really gave me confidence for the rest of my time there.
Yeah, no, I think that actually is great advice and carries over to any really situation where you're under a lot of pressure. Like you said earlier, changing and reframing that challenge and opportunity, having that positive thinking, I think it's a great way to deal with those situations. So thank you for that. I'm sure the listeners will take a lot of value out of that. In terms of, as you mentioned, you've had a bit of a unconventional career path. Could you maybe expand on that? What have been the biggest challenges along the way?
Sure. So, I mean, as I said, I graduated in 2000, and at that time, the system was slightly different for medical students. So you did what's called a house job for your first year, which was compulsory. You do kind of 6 months medicine, 6 months surgery. So I did that as expected. I said, not in Cambridge as I planned to, but half of it in Oxford for medicine. Maybe the half was in Walsall, which was, again, a different experience. I've lived in the south most of my life, and moving to the Midlands and quite a deprived part of the country, was quite an interesting experience. Very different to Cambridge, Oxford, certainly. And then the first decision you make as a medical student, or as a junior doctor rather now, is whether you go into medicine or surgery generally. So I decided I was more interested in medicine. So I applied initially to do A&E because I had a 6-month kind of gap between starting a medical rotation. So I did that in Nottingham, which at that time was the busiest kind of A&E department in the country, and we used to have very long waits for patients, like 8-9 hours. That was a good experience. Again, relatively high pressure. I think the main thing which was unusual, so I did actually follow, for the first 3 years, a fairly conventional path. So house jobs, and then 2 years what's called a senior house officer rotation in various medical specialities. But during that time, I'd already realized I was more interested in kind of public health, what causes disease, and I wasn't ready to give up clinical medicine. I asked advice from my consultant at that time. He said, if you go to public health now, you can never come back to clinical medicine. Whereas if you carry on doing clinical medicine, you can come back to public health later. And that's really what actually did transpire. So I carried on doing my clinical medicine consultant training. That carried on until 2009. But in parallel, what I did, which was slightly unusual, is that I started taking degrees in epidemiology and public health, and then my doctoral degree as well. I started at that time. I started working on projects, not really in my spare time, because I didn't really have spare time as a junior doctor.
Yeah.
But I took a few months out to work on UK Biobank in 2004. That was my first introduction to kind of large-scale epidemiological research. And then I became a consultant in 2009. And I guess the other thing I did, which was kind of in my spare time during that, was to set up a clinical research network in India, which hadn't really done clinical research at scale before. So that was a new experience, and a new experience for me as well as researchers in India. So that was unusual, doing that in parallel while working. But yeah, the next 10 years were slightly unconventional. So from 2010 to 2020, I actually spent most of that time abroad. So I was looking to set up what are called cohort studies, large studies where we study populations to try and understand what causes disease in the Middle East. And the reason I got that idea was not actually from me. It was someone called Sir Richard Doll, who's a very famous epidemiologist, really the father of kind of epidemiology in the UK. He set up the first study called the British Doctor Study, which established the link between smoking and lung cancer. So he's very famous because of the finding, but not everyone's heard of him. So obviously it's kind of, everyone knows that now, and it's kind of course, smoking causes lung cancer, but back in the 1940s and 50s, it wasn't known.
Yeah.
And he did the study that really established that. But he said to me, we've got no studies like this in the Arab world, so you should go and try and set up a study. I'm not sure why he asked me, but anyway, he gave me the idea. So yeah, 2011, I moved out to the UAE. So I lived in Abu Dhabi for 7 years. And I set up a study there. It was called the UAE Healthy Future Study. That was the first cohort study of its type in the UAE, and one of the first in that whole region. And so yeah, that took me like 2011, 2019. I was mainly out there, and then as I said, I came back for the pandemic, and then to set up
and then I've transitioned into Our Future.
But yeah, working abroad, it's not that no one does that, but it's not that common. And also kind of taking, in some ways, quite a big risk, because when you go out to live in a different country and work outside of the kind of conventional career path, there's no guarantee you can come back. So although I carried on doing some clinical work, like a month every summer when I came back from the UAE, it wouldn't have been necessarily that easy to get back into an NHS career.
Yeah.
But also from a research perspective, because I had taken this time out, it may not have been that easy. As it happened, thank God it was relatively straightforward, but it may not have been.
Yeah. Everything works out in the end, though, right?
It did. But I guess the main point is I was willing to take risks.
Yeah.
Because I saw the opportunities.
Yeah.
And for me, it's worked out. I know that who dares wins. I guess it's
always. But one thing that really stood out to me about your journey is the fact that you mentioned earlier being your belief and how much you advocate for being a lifelong learner. Something that I find really interesting is that I think a lot of people learn up until when they get their degree. They then go into their full-time role and they find themselves too busy to find time to then learn on the side. How did you manage to balance that between being a junior doctor and still studying degrees? Is there any tips you could give to students on how they can still find the time to kind of still develop skills on the side alongside that graduate role or whatever they may be working on at that point in time?
So time management is obviously kind of the key here.
Yeah.
And you're right, junior doctors are busy. We do work long hours. But actually the role I had for those 5 years from 2004 to 2009 was a kind of split research and clinical role. So half the time was in research, and that did give me more time to devote to the degrees. The other thing, I did all my degrees by distance learning. And I've got a good memory, which helps. So
yeah. I
was able to kind of do 2 master's degrees with relatively less work than maybe other people would require, just because I've got a good memory, so I could kind of cram. And in fact, that's always been I'm not advising this, by the way, but different things work for different people. But for me personally, I've always been able to learn quite a lot of material in a short period of time. So I'd kind of take a week off before the exams, read all the books, and that works for most things. I mean, there were assignments I had to do during the year as well. But yeah, because I was doing a combined clinical research role, it certainly made it easier. If you're a full-time clinician, that's much harder. If you're a full-time doing any job, of course, finding times in evenings, weekends, etc., is not easy, but it's easier now.
Yeah.
Because there's so much opportunity for distance learning. In fact, when I started, it was still kind of the internet, of course, existed, but the courses were delivered by book and paper. Now it's all online, which has made it even easier.
No, 100%. I think that makes complete sense. In terms of your work then at Our Future Health, is there anything so far, and I mean, if you can't share much, then that's completely fine. Is there anything so far that you found that you'd recommend to students right now out there that they can do to live healthier lives? Obviously, when you're early on in your life, one thing you are aware of is kind of that prevention and not wanting to get to a later stage and regret stuff. What would you recommend to students to do so?
So you're right, the study is in its early stages.
Yeah.
Although we have got 1.5 million people have already joined.
Okay.
So we've made a good start in the first kind of 1.5 years. I mean, there are certain conditions which affect young people more. So mental health disorder has been a big issue, anxiety, depression, obesity also is a big issue, even in younger people. So there are things which, in some ways, are very obvious. So in relation to many diseases, physical activity and a healthy diet are really important, and most people don't exercise enough, and most people don't eat a healthy enough diet. And it's easier said than done. But it does come back to some of these basic things. And often it's very small decisions. So if you ask people to go to the gym, for example, or to go for a run every week, and they may not do it because we're all busy and it's taking time out. But there's fairly good evidence now that even small decisions, like for example, in this building we're in now, you can take the lift or you can take the stairs. When you go to buy your lunch, you can buy a sandwich or you can buy a chocolate bar. There's these small decisions actually make a big difference. You can, if we're in London now, you can take the tube or you can walk. So these kind of small decisions that you make every day actually make a big difference. Doing housework, doing small tasks, standing up every hour, etc. These things do help. So it's not that you need to completely change your routine. It's those small decisions that accumulate over time and really do reduce your risk of disease like diabetes, heart disease, cancer. For mental health disorders, it's a slightly different challenge. Obviously, having supportive friends, family, etc., helps. Being able to talk to people when times are difficult is certainly helpful. But yeah, that's a slightly different challenge. Yeah.
So I guess part of it is just being more conscious of your decisions.
Certainly for physical activity and diet, yeah, that's certainly true. It will make a difference.
Yeah. And how important is sleep? Because I know that's a big issue, and I'm sure one that you've experienced in your time.
No, you're right.
Having been a junior doctor, so how important is sleep?
I should have mentioned sleep. Now, sleep is really important. So there's very good evidence now that people that sleep less than 7 hours a night, have worse health outcomes. So somewhere between 7 and 8 hours seems to be ideal.
That makes me feel really bad about last night.
I mean, as a student, actually, I was quite good at making sure I had a good night's sleep before exams.
Yeah.
So I knew at that stage, and I remember in my first year at university, my neighbour, she used to kind of stay up the whole night and cram, before the exams, and I used to kind of go to sleep fairly early and get a good night's sleep. And this is only a small trial of 2 people, but unfortunately she failed her exams and I managed to do quite well. So that was a kind of lesson for me that because people do that as students, that they do try to stay up all night. But my advice generally, not just for exams, but in life in general, is to kind of prioritize sleep over most other things because it's really important for health, and there's a lot of evidence for that now.
And would the amount of sleep that's needed vary from student to student or person to person?
It does vary, and we're getting better data now. And in fact, physical activity, diet, sleep, all of these things, you can make general population recommendations, but it's true that what is best for an individual does vary. The problem is it's quite hard to know what is best for you as an individual now. I mean, if you ask me in 10 years' time, I suspect we'll have much better data. And our future health will actually help to show how we can track individual people. Because at the moment, mainly what we do is to look at the whole population and then look at averages and then say, but you're right, there will be people within that. And the technology has moved on now, so we can see based on your kind of genetic makeup, other things that we can measure in your blood, and measuring physical activity, diet, etc. for you as an individual over a number of years, what that leads to. And you're right, you'll find people like Donald Trump, for example, or Margaret Thatcher, for some of our older listeners, who used to sleep a very short time, but in some ways have been very successful. So there's always these kind of exceptions, but at population level, it's certainly true that good night's sleep is very important.
And so something you mentioned there is that kind of that personalised healthcare. Is that where you're looking to move towards in the next 5 to 10 years of our future health, is being able to actually provide that personalised insight into how you can live a healthier life, how you can prevent these diseases?
Exactly. So yeah, currently we're mainly based on population level advice, but we need to develop interventions that are tailored to the individual. So we talk about precision medicine. Some of your listeners will be familiar with that, and that's really about getting the right treatment to the right person at the right time. What we're trying to do through our future stuff for something like cancer, each tumor is different, and you can now tailor your treatment to that particular tumor. For prevention, that really hasn't been tried yet, and we're looking at this, what we call precision public health or precision prevention, where we're trying to understand how to prevent disease in individuals. And that's really what our future health will have a transformational effect on this field, because it's never been possible before.
Yeah. And I think it will have a big impact, like you said, with sleep. There always is and I think you can often lie to yourself when it is population data that you're given. You can always lie to yourself and say, oh no, but I'm one of those people that doesn't need 7 to 8 hours sleep, even though you're not aware of the effects it's having on your body yet.
Yeah. And there's lots of things going forward we'll be able to measure, as I said, in the bloodstream, wearables, etc., that will give us much better data on this.
And what are the biggest challenges to getting to that future, would you say?
So the first challenge is collecting the data. Our future health will certainly help with that. So having data on 5 million people. The other thing we're trying to do through our future health, which hasn't really happened before, is to get people from every type of background. So different ethnic groups, different socioeconomic groups, every part of the country, all ages. So it's the first study that's open to kind of 18-year-olds plus. So we've got a very large number of young people that have joined already, but we're very keen to get more younger people. So the group least likely to join are 18 to 29-year-olds, so which is very much your listenership. The group most likely to join are 60, 69, as you might expect, because But if you want to live a long, healthy life, which is what we're aiming to do through our future health, it's best to start as early as possible. So collecting that data is the first step, but then researchers being able to analyze that data is the next step. And what we're doing at our future health is to make the data available to everybody. So anyone can apply, research with the NHS, from universities, etc. And UK Biobank did the same thing. That was actually very helpful because it meant that you can maximize the opportunities from that research. And the third thing is to test interventions on people to see, does this intervention lead to better outcomes and is it cost effective? And again, we'll be able to do that through our future health.
Amazing. I can't wait for that. In terms of, you mentioned a lot there about kind of the physical activity, the sleep. In terms of mental health, is there anything that students can do to help improve their mental health? I think that's something that a lot of listeners will be able to relate to, is that everyone throughout their journey, especially at university or going into their graduate role, will go through periods where maybe their mental health suffers. What advice would you have for them at that stage of their life?
So mental health is harder in terms of tackling it, partly because we don't understand all of the risk factors as well. And there are lots of things which are outside of health care, which obviously impact on people's mental health. So I think for the first time, I said we've got a large enough study to really understand those risk factors better. So if you come back in a few years, I'll be able to give a better answer. For now, what evidence we do have is that being able, so-called talking therapies, so being able to talk to people about the problems you're having, anxiety, depression, stress, etc. There's good evidence that leads to improved mental health. Some of these mindfulness techniques, etc. What I don't think we should be doing is over-medicalizing, anxiety and depression in particular. It has increased, and that's partly, COVID didn't help, of course. Economic situation, cost of living crisis, etc., hasn't helped with all of these things, and that's what's led to some of these increases. But yeah, some of these techniques there is evidence for. I think we'll have better evidence in the coming years, and ideally without having people to take, medicines, because all medicines have side effects as well.
Yeah.
And if there are things that we can do that lead to better health outcomes, whether it's obesity or mental health disorders or any other disorder which don't involve medicines, I think that's preferable.
And ideally get into a future where we can prevent the suffering in its entirety, right? Rather than having to go through it and then treat them.
Exactly.
Ideally, we'd be able to prevent it beforehand.
I mean, most of the causes of disease lie outside of medicine.
Yeah.
A lot of it, I mentioned briefly earlier in terms of my own background, growing up in relative poverty, if you like, difficult childhood circumstances, that's given me an insight into the challenges that people face, and that doesn't help. Most outcomes are much worse for people from the poorest backgrounds. Whether it's mental health disorders, whether it's obesity, diabetes, cancer, heart disease, etc. On average, and it's shocking in some ways, but people from the most deprived backgrounds live 10 years less than the least deprived backgrounds, and that's in England, or across the UK, and they have 20 years lower healthy life expectancy. So they live in good health for 20 years less. If you live in Blackpool compared to Westminster, there's a 20-year gap. And that shouldn't be the case. So that's something which, as I said, does lie outside of medicine in many ways. It relies on not just government, but certainly government has an important role, but government and society seeing how we can reduce those inequalities, how we can provide better opportunities for young people. And that starts from a very young age, really at primary school or even before that. So children have, I was lucky, I had very supportive parents, they provided, although they didn't have money to support us, they provided a stable kind of home environment that we could study and take those opportunities to get a good education. And that's really where it starts.
I think it really is an amazing mission that you're on. I definitely would love to be able to speak again in a couple of years and see how much more insight you have for the listeners. I'm sure there's already a lot they can take away. 2 final questions for you. The first is, now being a CEO, and as you mentioned, having led kind of departments or led teams in the past, what have you learned about what makes a good and effective leader?
So for me personally, it's the most important thing. There's a few things which have been helpful for me. This doesn't apply to every situation.
Yeah.
But certainly for leading our future health, having a background as a medical doctor, having seen patients and being able to explain to people why this is so important has helped for my team as well. Because although it's a great mission, our mission is to enable everyone to live longer, healthier lives. No one's going to disagree with that. And people that join the company, they're very much committed to that mission. But being able to explain to them how it's really going to help, enable them to maintain that motivation. So that's certainly been important for me at our future health. Secondly is kind of the people skills. So, and that actually, again, being a doctor has helped with that. So dealing with not just your executive team, but anyone across the whole organization. And very much I try to lead by example. So I don't ask people to do something usually that I wouldn't, be able to do. If I can do it myself, that I would do myself.
Yeah.
And also I always stress this is an opportunity. I don't see, although I am leading the project, it's a privilege, to be able to lead a project like this. It's something I could never have expected, not just because of the circumstances I grew up in, but just in terms of my career. It's not something I would ever have thought it would be possible for someone like me. to do. So I'm very grateful for that opportunity. And I think the rest of the team, they can see that, we are a mission-led organisation. But I also always say, a good mission or an amazing mission is not enough. I mean, even in the NHS, we see junior doctors going on strike and struggling, even though they've got, they are literally saving lives. But you also have to make the work environment as good and as productive and as pleasant as possible for the team. And that's what I've also tried to do at Our Future Health.
I think that's some amazing advice there. I think especially I love the fact that you said about leading by example, the fact that you have this background in medicine. I think it's something I always preach. I've always believed myself is that when you're a younger person, when you're less experienced in your career, don't be afraid to do the tasks that maybe don't seem like something a CEO should do, because actually, if you do reach the point of CEO, it may feel uncomfortable to be able to say to someone, hey, can you do this? Even if you've never ever experienced it yourself. So doing that kind of groundwork yourself at some stage in your career is then, I assume, makes it easier to lead when it comes to that point.
No, it certainly does. And people, I do tell them about my background because I think it helps them to see, if someone like me can get to this position,
yeah,
then they should also, I want people to be ambitious. I want young people, students who may think they couldn't achieve what I'm doing now, that it is possible. Of course, you have to work hard and you have to have an element of luck as well, opportunities that have to arise over time. But certainly, in the UK, we're very fortunate that we have really good opportunities to get almost anywhere if you're willing to work hard and take the opportunities that arise.
No, I love that. And the final question, what is your final piece of advice for students listening?
So the first piece of advice is please join Our Future Health.
Definitely.
So you can join online. You go to our website, which is ourfuturehealth.org.uk. Yep. You just sign up online. But no, the most important thing I say, whatever your background, ethnically, socioeconomically, geographically, don't feel that you can't achieve something because of that. I'm one example, but there are many others, across all fields, not just in medicine. And in fact, medicine used to be dominated by people from private school backgrounds, but now it's changed a lot. There are people from every background that are becoming doctors. There are people from every background becoming lawyers, becoming managers, teachers, etc., all walks of life. So don't limit your ambition because of that. Secondly, of course, you have to work hard. There's no shortcuts. Although I said I was good at cramming and good at, I had good exam technique. I mean, of course, I've worked extremely hard to get to this position. So there really are not shortcuts. But thirdly, don't be afraid to take risks. And actually, it's easier now in the way that the world of work is. You don't have to be in the same job or the same career forever. And I've changed careers in some ways. What I do now is in some ways, quite far from being a doctor. Running a company, being involved in all the financial, legal, administrative aspects of running a company. But it ultimately will lead to what I want, which is to help people to live longer, healthier lives. So don't be afraid to take risks and to do something slightly different, and to do it for a short time and then come back. So, the opportunities are massive out there. Sometimes people are a bit negative about the UK. I certainly don't see that. And they're thinking, I hear about people saying I'm going to move abroad or I'm going to go and work in Australia or the Middle East, whatever. I really think the UK is one of the best places in the world to achieve whatever you want in any career.
Yeah, no, I love that. I think that's a great way to wrap it up. And thanks again so much for coming on, Raghib. I'm sure there's a lot of value there for our students.
Thank you.
Thank you.